Hi, this is Dr. Christy with Body Bar MD, and today we are going to be talking about how I approach a face consult. So, obviously, it is a concern of people of all ages. I'm just feeling a little draggy, I'm looking a little bit older, I'd like to look refreshed, rejuvenated. These wrinkles bother me, this spot bothers me, the sag bothers me. It can be any number of things. So I like to approach it in a global way. So there are going to be things of what we call dynamic lines and then static lines. So dynamic lines are going to be movement based lines. So that's our scowl and our crow's feet when we smile, and our wrinkles on our forehead when we raise our eyebrows. Those are what we call dynamic lines. And those tend to be amenable to neurotoxins. And again, neurotoxins, Botox is kind of the name, but it's like Coke and Pepsi. There's multiple brands. For the most part, they all work the same way, and basically what they're going to do is they're going to paralyze that muscle. So they're going to, if you think about like a paper being like this and the wrinkle being here, when you put the neurotoxin in, it relaxes that muscle so that you flatten it out and you get a nice smooth skin. It's kind of a gateway drug in the aesthetics world, because it will really help kind of smooth lines, make us look a little bit younger. But then when we go on to other things, we tend to think about what I call the 3 T's: texture, tone, tightening. So texture are going to be those fine lines and wrinkles. We hear a lot of people talk even about, lip lines, and they're like, well, but I'm not a smoker. How did I get these? We get them from drinking out of straws, drinking out of water bottles. So texture is going to be fine lines and wrinkles. Tone are going to be reds and browns. So those might be sunspots, those little vascular lesions that we can get are the biggest two. Just uneven skin tone, even things like melasma. And then the other is obviously going to be tightening, and that's to kind of tighten that skin back up. In my opinion, this is where lasers come in. So this is going to be natural rejuvenation, where you're using a type of either laser or radio frequency microneedling. There's multiple different modalities that will do this. And essentially, it creates a wound in the skin. Some of them go deeper than others. Some of them are what we call ablative, meaning that when it breaks the skin, you're going to see it on the surface, or non-ablative, meaning that you're not going to see it on the surface, but it's down underneath doing its work. When we get a wound, basically our body says, hey, there's a wound here, and it pulls in collagen and elastin are the big ones that get pulled in a wound. So collagen helps give us that thickening so we don't have that fine, wrinkly skin. And elastin is just like that. It helps give it that stretch back. And certainly there's a variety of other chemicals and chemical signaling that take place with a wound. But the idea is that it's going to help over time tighten things up and smooth out that texture. What I mean by ablative and non-ablative really has to do with how much downtime do you want, how much pain, and how many treatments are you wanting to do. When we talk ablative, generally those tend to be a little bit more painful along with more downtime. A CO2 is a perfect example. That's kind of the gold standard, but it tends to have the most downtime. Somebody might look like a burn victim, but boy, when that skin heals, it is going to be smooth as baby's butt. Then it kind of goes down the line as far as other ones. There are ones that aren't ablative at all. Literally, you walk out the door, nobody knows you've even had anything done. They don't hurt. You can fall asleep while you're having the treatment. Looks great. Those are just going to take more time to build that collagen up from the bottom up. You're not going to get this wow factor right away, But if you trust the process and you're committed to it, you will definitely see some improvement. So from a laser standpoint, we really kind of pick and choose based on your specific needs, your downtime requirements or lack thereof, and expectations with one treatment. So that's very individualized, but overall, from the standpoint of the technologies that we have the whole kit and caboodle. We've got ablative, we've got non-ablative, and over time, ultimately, they will all achieve the same results. The final piece in this are going to be things like using PRP and filler. Filler is going to do just that. It's going to add volume where we don't have it. Lips are certainly the most common thing. Everybody wants, pretty lips. Filler it lasts about a year. There's still evidence that there is still some filler around, and after your skin kind of gets used to holding a little bit more volume, I have found that you don't always go back to where you were before. You tend to retain just a little bit of volume, even if you've done filler even once. Fillers take time as well. I am not a fan of let's put 5 or 6 syringes of filler in the face at one time. I believe it's a building process. Like for lips, we're building structure and then we're building volume. Same thing with cheeks. I like to minimize the use of fillers only because, one, again, sometimes they stick around longer than we want to, and the face starts to take on a little bit of an unnatural appearance. My personal philosophy, and probably most of my patients, is one of what we call natural rejuvenation. We're not trying to look 20 years younger, but I definitely don't want to look my age. I certainly don't want to look older than my age. So when I talk natural rejuvenation, the perfect complement is that, man, somebody looks really good, or your skin looks really good, it looks really refreshed, but they don't quite know what you've done. That is, to me, the best compliment of the process. And that being said, it's also an understanding that it's a process. The people, in my opinion, that have the best results are the ones that kind of trust that process over the course of a year, and we build little things over time, and that's really where you will see a true transformation. And you can start with any or all, but I do tend to recommend a progression of small treatments over time to get the best results. If you have any questions about this or you're interested in learning more, check us out at bodybarmd.com.